More than 1,500 delegates, including global health experts, policymakers and community leaders, are expected to attend the 7th South African TB conference in Durban. The conference is expected to see plenary discussions about medicines and the way to treat airborne diseases. South Africa is said to have alarming TB infection rates, coupled with the largest HIV/AIDS prevalence globally. TB experts say that COVID-19 pandemic has derailed decades of work around TB testing and treatment. All right, let's cross to our reporter then in Durban, Jade Paulse, for the latest on the conference. A very good afternoon to you, Jade. Right, we're about an hour away from the start of the official program, but take us through some of the great conversations being held on the sidelines before this conference, but also what we're set to expect as the conference does certainly get underway in the next hour.
Well, a very good afternoon to you, Flo, and to the viewers back at home. And yes, welcome to the SATB conference that will be running until the 16th on Friday, where we see a lot of community leaders as well as policy makers and global health experts descend into Durban to discuss some mitigating factors and also issues surrounding TB, tuberculosis across the country, but also globally. We do know that it has been a 2-year hiatus since we've had this conference with the COVID-19 pandemic, but it's all systems go. I can still see delegates getting their accreditation. If Rembele behind the camera can just show you, some are still fetching their last minute accreditation to make it into those plenary sessions, Flo, so they are able to listen to some of the keynote speakers who will also be addressing them, and it should be starting at 3:30 promptly this afternoon. There were discussions and talks that they were going to push the program a bit later, but I'm told that the program will start at 3:30. But just to talk to us about why we are having the TB conference, the importance of having this conference, I am joined by Russell Rensburg, and he's from the Rural Advocacy Group, the Executive Director. Talk to us about the importance of this conference, Russell.
I think I can't understate the importance of this conference. I mean, after a 2-year hiatus because of COVID is one of those diseases that have been severely impacted. For the first time in 10 years, we've had an increase in TB deaths and a decrease in notifications. And we definitely need to come together as politicians, as activists, as policymakers and researchers to get the TB response back on track. And the conference is an important opportunity to do that.
I know many back at home are saying that more needs to be done on the TB front. We did see with COVID-19 there was PCR tests that were readily available after some time, getting your results out immediately. But with TB, it's a totally different thing. Once you get tested, you have to go back to the clinic or hospital to do follow-up tests, and this is quite lengthy. And many people don't follow up with their testing, and that's also a hindrance when it comes to testing in TB.
Absolutely. I think the treatment regime or the diagnostics around TB are complicated. It does require a lot of autonomous action from people living with TB. And I think another challenge is that you have to interact with the health system in order to test for TB. It's not something you can do at home. You can do a COVID test now. And I think that's why we need to start thinking about how do we coordinate and govern the response to TB, that we don't just do it at conferences, that we distribute this governance from the national level to the local level, as well as the provincial level, and we work with communities to ensure that we leave no one behind and we find those 150,000 missing patients that we don't get to treat every year and avoid deaths. Because unfortunately 61,000 people is 61,000 families, and those deaths can be avoided because TB is treatable and curable.
When we look at TB in rural areas as well, in particularly in KwaZulu-Natal, where we're seeing TB at the forefront. I think we've got the highest number of TB patients in our province. Just talk to us about other provinces and also some of the districts where you're finding the prevalence of tuberculosis.
Look, I think the prevalence at the moment we have got what they call the TB recovery plan, and we've identified as a country 12 high priority districts that are scattered all across the country. 4 of them are in KZN. Include areas like KCD, Ugu, the city that we're in, eThekwini. Then we have Gauteng, the city of Cape Town. There's 3 districts in the Eastern Cape, Nelson Mandela Bay, Buffalo City, Amatole, and OR Tambo. So it's quite widespread. And I think one of the challenges with TB in the rural areas is, like I said earlier, you need to actually interact with the health system. And in rural areas, the health system's far away. One of the studies that we'll be profiling at this conference is a study by Cobus Hurst and his colleagues, who went into northern KwaZulu-Natal and screened people for a number of different diseases, including TB. And they found a prevalence rate much higher than one would normally found. And these are people that don't interact with the system. And one of the things that we want to do here is finding ways that we can reach out into communities so that we can reach those people that can't access this life-saving treatment.
While I was doing some of the research back home ahead of this conference, I was also reading that KZN was highlighted. It was one of the provinces that actually found patients who were TB drug resistant. So the drugs actually weren't assisting those patients and they weren't able to help them. Will we see at this conference some talks surrounding drug resistance and impatience, and just talk to us about that?
Yes, absolutely. And I think maybe the response to drug resistance TB is one of our successes. We're nowhere close to obviously covering the treatments remain complicated and difficult, but we've come a long way from the early days of drug resistance TB to the point now we're actually closing down TB hospitals because we haven't got much of admissions. There's about 10,000 people living with drug-sensitive TB, and I think fast forward to where we are now, we're actually in a position to start closing TB hospitals because the admissions are so low. So maybe we can look at some of the lessons that we learned from there to improve it and extend it to drug-sensitive TB as well. But yeah, this is a battle of many fronts, and it intersects directly with other disparities within our societies, poverty and inequality, because TB is concentrated amongst the poor. The poor often have very little political mobilization or even interest. And there's even a well-known medical maxim called the inverse care law, where the people that need care the most are the least likely to seek it. They'll keep delaying it and delaying it. And that's why it's so important that when we have these conversations, that it's not just the scientists and it's not just the politicians or the bureaucrats, but it's everybody that is infected and affected by the diseases that are participating in finding the solutions and taking us forward.
And the civic societies such as yourself also at the helm. Thank you so much, Mr. Rensburg, for chatting to us. Well, Flo, that was Russell Rensburg from the Rural Advocacy Project talking to us about what his expectations are at this year's TB conference, but also what they're going to be tackling. We do know it's been a 2-year hiatus. We do know that COVID-19 pandemic has been at the forefront, but there are other diseases, there are other issues within our health system that really also do need to be pushed back into the forefront, and TB is one of that. So we are expecting many experts around the globe to come together, put their heads together and talk about some of those initiatives and how they're going to be combating the prevalence of tuberculosis within the rural areas. I'm going to throw back to you in studio.
Many thanks to you, Jade. All right, we will be, of course, crossing back to Durban, where indeed that conference, the TB conference, is set to get underway. As soon as those proceedings do get underway, we'll cross live there for you.